Healthcare may be the sector where one of our deepest contradictions becomes visible. What happens when a system devoted to caring for human life erodes the very relational conditions that the people providing that care need to remain fully human? That question became the defining inquiry of my professional life. For 22 years, I worked inside the World Health Organization, the global standard-setting agency for health in the United Nations. And my work was about making health systems more people-centered. And I believed in it. I still do. But year after year, I saw the same pattern repeating. The people tasked with caring for others were often left without the relational conditions they needed to sustain that care. The health workforce was treated as a delivery instrument for health services. Even after decades of advocacy and training, patients and communities were still seen as passive recipients. Organizations spoke about engagement, participation, but continued to operate through transactional top-down ways of relating. And these aren't failures of individuals. They were inherited beliefs and professionally trained patterns of relating, and they ran deep. I witnessed this pattern playing out in every health system I worked alongside. But what I couldn't yet see was that the same pattern was also living in my own body. Hello, my name is Asia Odugli-Kolev, and I'm the founder of Relational Futures. I've been shaped by many worlds, a nomadic pastoral African heritage, a 1970s British upbringing during a time of racialized violence and social upheaval, and an Eastern European marriage. Each of them gave me something real. Each also gave me beliefs I hadn't chosen and hadn't fully examined. My early childhood traumas were severe, and they shaped a nervous system exquisitely tuned to detecting threat. It gave me a capacity I relied on for decades. I could read what was not immediately visible. I came to understand how I could be physically present in every room I entered, but I did not yet know what it meant to belong inside myself. The journey back to me wasn't about insight or theory. It became 14 years of daily practice, breath, rhythm, presence. I had to learn what my body had never been taught, that safety and connection were possible. I also had to uncover beliefs that were no longer true and find ways to loosen their hold on me. And as I changed from the inside, I started to see something I'd missed for years. The patterns in the human systems that I worked in and grew up in, and the patterns inside my own body weren't separate. They were expressions of the same underlying processes. I saw this even more clearly through one of the most important relationships in my life, parenting my daughter. Across her childhood and adolescence, I watched how relational conditions shape human development in real time, and I discovered something humbling. Parenting was never only about responding to her. At every developmental stage, something in me was being activated too. Experiences from my own childhood, many held outside awareness, would surface through ordinary moments of parenting. So I had to keep asking myself, what belongs to my story? What am I projecting? And what is actually her reality? That distinction mattered deeply, because children don't only learn from what we consciously teach, They relearn from the relational field we create around them through our presence, our pace, our nervous system, how we respond to rupture, and how we repair. Over time, I could see what repeated relational conditions made possible. My daughter developed the capacity to hold her ground in emotionally complex relationships without losing herself. During her father's and my divorce, she didn't take on blame. She remained connected to both of us. And she knows she is loved by both her father and me. That experience taught me something I now carry into all of my work. Every interaction is an intervention, and communication has bioactive properties. The moment that confirmed all of this in the work of health systems came during the 2014 Ebola response in West Africa. I'd reached a point where I had nothing to protect and everything to test. I led an international team working with national counterparts, and we did something that challenged the way things had always been done. We set presentations aside. Every training was different because the people in the room were different. We selected trainers who could facilitate experiential relational learning, not just deliver slide decks. And in a single day, we felt the energy in the room change. The heaviness that people carried in that morning gave way to lightness, connection, and possibility by the end of the afternoon. Contact tracers who'd been met with aggression from communities were able to build such deep trust with families that they named their newborn babies after them. And the members of the rapid response teams themselves started to pay for phone credits and household essentials from their own pockets for the communities that they were working in. They actively sought difficult situations because they wanted to test what they'd learned. They felt that confident. What I learned in that room and what my own journey and years of parenting had already shown me was the same thing. Relational capacity is not a soft skill. It is biological, it is physiological. It is the substrate on which every human relationship in every team, every family, every community, and every system rests. You cannot train it through a slide deck. You cannot force it through policy alone. But when the relational conditions change, everything becomes possible. And that's why I created Islands of Coherence. Not as another resilience program, not as another communication course, but as a way to explore what becomes possible when we restore the relational conditions that allow people to remain fully human while caring for others. After 22 years, I no longer believe the deepest crisis in healthcare is a lack of knowledge, commitment, or compassion. I believe it is the erosion of the relational conditions that allow people to remain fully human while being able to care for others. This channel is where I'll be exploring that possibility. If you've ever felt that something is deeply wrong with the way we work, but couldn't quite name it, you're in the right place. Because the system is failing. You are not.